Welcome to the June 2015 Kaweah Delta Newsreel. This month, we'll learn from Trauma Program Manager Amber Woods how to enjoy a safer summer. But first, Emergency Medicine Specialist Dr. Steve Karstens will tell us when a patient should use the ER.
So people would generally use the emergency department if there's a serious concern about their health. Now, that could be a medical problem or a problem related to trauma. So common reasons somebody would go to the emergency department would be, say, with chest pain, especially radiating to the arm, going to the arm, or with difficulty breathing. Another one would be somebody with serious bleeding, and that could be vomiting blood. It could be a pregnant woman bleeding. Another cause would be somebody with a severe sudden onset headache. They might want to come into the emergency department. A headache's different. Somebody with vision problems, somebody with difficulty speaking, somebody with confusion that's new. Another common reason is a newborn with a fever. The parent should probably bring that child in for us to take a look at the baby. We see a lot of trauma in the emergency department, and that could be somebody with a fracture, usually to an arm or a leg. And then there's different reasons why somebody would come to the emergency department. But that's kind of a broad overview. One of the values of the urgent care and the Kaweah prompt care is for those patients who can't get in to see their doctor, their primary care doctor, usually for non-emergency conditions, say for a cough or a cold, or other minor complaints. It would be a good reason to go to our Kaweah prompt care or the urgent care. The main differences between the emergency department and our urgent care and Kaweah prompt care, the fact that our urgent cares do have x-ray, they do have labs, they're only open during certain hours, which is helpful to the community because it's hours that somebody might typically require help. And that goes as well for the Kaweah prompt care. There's, and as I said before, if there's something that needs a higher level of care, such as the emergency department, they could send those patients over for us to see them in the emergency department.
A couple of summer safety tips to help your family this summer would be if you get stung or bit by a bee or wasp, you want to remove the stinger first. After that, you want to apply a mild soap and water to wash. A cool compress also helps, and beyond that, you just need to get some calamine lotion for the itching. As far as drownings go, we need to make sure that we watch our children at all times. Drowning is the leading cause of death for trauma, ages 1 to 4 years old. And unfortunately, we rely on things like noodles or arm floaties to protect our children. The best thing that we can use is a life jacket that's approved. And then the last thing with heat exhaustion. Wear loose-fitting clothing. You want to remove yourself from any hot spots, and you want to make sure that you hydrate at all times. Water is the best thing. If you're going to be outside for extended periods of time, make sure you take breaks to go under the shade and bring water with you throughout the day.
That's the newsreel for this month. Thanks for watching, and we'll see you next month.